The nasal valve has always been known to be the narrowest portion of the nasal airway for patients. In the past, our ability to treat it was very complicated, usually required surgery that could change the shape of the nose. We now have a treatment option that allows us to markedly improve the nasal valve with really almost no involvement of any kind of surgical procedure. VivAer is a non-invasive procedure that uses radiofrequency to change the cartilage that forms the nasal valve. It can be done in the office under local anesthesia, and the recovery is almost immediate. Improvement usually occurs over the following week or two as the nasal valve opens, and then we have good long-term data now that states that that condition stays improved for years. I treat a lot of patients with nasal airway obstruction. I think there are a lot of patients out there who don't know the various options or don't care for the standard options that we have to treat that, which usually involve either chronic medication or surgery. The ability to treat something like this in an office-based procedure with minimal complications or risks involved, I think is very valuable to the patient. After the VivAer procedure, I inform my patient to expect some nasal congestion and stuffiness for a few days, although they are able to resume complete normal daily activities immediately. I have no restrictions on anything that they do. At a month, they should really start seeing marked improvement in nasal breathing. I was involved in some of the initial studies using VivAer because I thought this was a need that we really had in our field. I found it very simple to do here in the office. I felt very comfortable and confident offering it to my patient as a treatment option.